Good afternoon, members. We have already formed a quorum. It is also time to start. So, members, I will make a start. Welcome to the special meeting of the panel on health services. Today is the 19th of March. Item 1. Corporate governance and manpower situation of the hospital authority. At the meeting held on the 18th of February, members decided that we should hold this special meeting so as to receive deputations concerning the corporate governance and manpower situation of the hospital authority. Our secretariat has already prepared a background brief, paper CB bracket 2 965/18 to 19 bracket 02 is for members' reference. Well, we have 61 deputations and individuals attending today's meeting. We are going to divide the meeting into two sessions. The first one between 5 p.m. and 6:50 p.m., receiving 32 deputations and individuals. The second one to be held between 6:55 p.m. and 8:45 p.m., receiving 29 deputations or individuals. I'd like to ask our secretariat to invite the deputations as well as the individuals for the first session to enter the conference room, as well as the representatives of the administration. 5 submissions from deputations or individuals not attending the meeting have also been received by the panel. So, you have a very strong team. I'd like to thank the Secretary for Food and Health, the Permanent Secretary, Dr. Leung, Dr. Ko, etc. Thank you for attending our special meeting. Please bear with us. Let's give time for the deputations and individuals to take their seat.
I
would like to welcome the ladies and gentlemen to our meeting. I just want to remind the deputations about the following. Please use the microphone, and you may also use the earpiece. Channel 0 for the floor, Channel 1 for Cantonese, Channel 2 for English, and Channel 3 for Putonghua. I must also remind you that when you address us, you are not covered by the protection and immunity provided under the Legislative Council Powers and Privileges Ordinance, Cap 382. Again, your written submissions will not be covered by the ordinance. Please take note of the security measures set out in the note for members of the public attending meetings in conference rooms or observing meetings in public galleries in the Legislative Council complex. We have already sent out a copy to you when we sent the letter to you, and you may also approach our security staff members if you're in the public gallery and if you're interested in getting a copy. Let me once again welcome the deputations and the individuals for coming to our meeting. Let me check with the Secretary if you would like to start with some opening remarks. Yes, I can give you a briefing, but it's up to you. I'll give you some time, and then we will receive the views from the deputations. Thank you. Thank you, Mr. Chairman. I think we're all here to listen to the deputations as well as the individuals. If I may, first of all, tell you what the hospital authority has done to enhance corporate governance and to address the manpower situation. I think you understand that the hospital authority is responsible for managing all the public hospitals in Hong Kong. We have got 78,000 staff members from a wide range of professions. They serve the public. For the year 17-18, we have been providing service to 22 attendances. They come to the A&E department, and they have also been admitted to different wards. So you can see that the volume of service is huge. We have got a number of measures to retain staff members as well as to recruit new members. For the year 2019-2020, $69 billion will be provided to the HA. When compared with the previous year, it is an increase of 8.5% over the revised estimates. The human resources would be the most important asset of the hospital authority. In the coming year, the administration is providing an additional of $720 million as recurrent subvention so as to boost the morale and to retain the staff members. And the HA is currently coming up with the details of the various measures, hoping that starting from the 1st of April, we are able to implement the enhanced measures so as to benefit the frontline staff members. Say, for example, we have the special scheme to rehire the retired members. We have the SHS special honorarium scheme, and then for the nurses who have undergone specialty training, they will be given better employment conditions. And we have also other measures to retain other allied health professionals. And then for the winter surge, we have also got a special allowance scheme to address the problem. We have come up with short-term, medium-term, and long-term measures to retain staff and to include new staff. For the short term, we are going to recruit the local medical graduates, 520 graduates from the medical school, as well as 2,500 nurses, so that those who are interested to work for the HA will be offered a job. And then we have the special honorarium scheme. We have also got the special retired and rehire scheme, and we have also got the locum office, so as to address the problem of short-term manpower shortage. And then we are going to set up a talent pool so as to provide manpower resources to the public hospitals. And then we are going to have the FRH, fixed rate honorarium for doctors, so as to compensate for the overtime work carried out by doctors. For the medium term, yes, we do understand that owing to special reasons like family needs or health reasons, they may not be able to have full-time work, and then we would like to try out a flexible or fractional work arrangement so that some frontline staff members will be able to opt for a more flexible work arrangement. Since the year 2011, we have been able to recruit non-locally trained doctors with limited registration. The HA is currently carrying out a number of enhancement measures, like we would like to have better communication strategies, and the HA will continue to talk to the stakeholders so as to make sure that there will be better arrangements for specialist training and internship training of LR doctors so that we can attract more non-locally trained doctors to work for the HA.
There is also enhancement of promotional prospects, and as in particular for the pharmacists and we will enhance training to raise the standards, professional standards, and strengthen their sense of belonging. And also for the supporting staff, we have an external consultant for a study, and we have follow up the first stage of study, in particular the supporting staff views, and in particular the problem of retention. And in 2019 and 20, we are going to recruit 420 additional EA to relieve administrative duties of nurses. And for long-term manpower plan, and we have looked into the workload projections, including the needs for doctors, nurses, and pharmacists. And we will communicate closely with the HA and accord relevant resources. And we will also provide more flexibility to retain talents. And there will be vocational training for supporting staff to increase their skills so they can deal with clinical needs. And will also help them to have promotions in their career. As for the funding, we will maintain public hospitals and also try to reduce the administrative workload. We know that there is an upsurge, and we understand the heavy workload that the frontline staff face. In order that they may concentrate on clinical work, we will we are now making arrangements whenever it is possible. We would also appropriately reduce meetings during the winter upsurge, and we will have information technology to increase the efficiency of work. And for the HA board, we will also further delegate the authority to specific committees, at the same time maintaining leadership and management and not affecting professional judgment. We will have more transfer of documents and not rely less on regular meetings. So we will thus shorten the meetings and workloads. The Food and Hygiene Bureau, in the beginning of the month, on the 4th of March, we had a meeting with the stakeholders, including the medical faculties of the 2 universities and the medical council. All participants recognize that there is a shortage of doctors in public hospitals, and we need to have a solution to that. At that meeting, we also looked into the matter of increasing non-locally trained doctors to serve in the public hospitals. We have a consensus on the incentives. For those who have passed the exams and for those who have limited registration of non-locally trained, we should do away with the internship. But in fact, that will help the attraction of non-locally trained doctors to come and serve in Hong Kong. So we are now recruiting 100 non-locally trained doctors in the coming year. We also discussed the solutions for the attraction of non-locally trained doctors. Such solutions would have to be discussed with the medical personnel in Hong Kong. And we will have meetings with the medical faculties to see if we can have better ways of attracting limited registration doctors to come to Hong Kong. And in particular, these doctors could also provide training for the medical faculties. Now, as for nurses and other professionals, we are now closely communicating with HA for further plans, and there will be follow-ups. Now, I and the HA representatives present here are ready to hear the views expressed by the deputations and individuals. Well, I will invite the officials to reply in one go after the deputations and individuals have spoken. Now, since time is limited, we will remind you that you would have 3 minutes for your presentations. And I will remind you also that after the meeting, if you have not already done so, provide written submissions to the Secretariat. First, Mr. Chang Yan Long, the Association of Hong Kong Nursing Staff. We have already made a written submission to the panel. In this submission, we have concentrated on the corporate governance and manpower situation of the HA, in particular on the nurses. For every year we have a winter upsurge, and every year we have come out for protests. And this year there has been some responses. Well, in our submission, we have pointed out that nursing staff problem could be solved. However, that we have to have fine calculations of the staff needed. HA has been building hospitals. However, the hospitals could not be run in a manner to full steam because there's a lack of personnel running it. And we hope that such a situation can be improved. Every year, we also see that there will be increasing recruitment of nurses. However, the 1,000 nurses recruited every year can only fill up the attrition rate, that is to replace those who have left. So it means that all in all, we don't have enough nurses, despite the increased recruitment, because there are lots of nurses going to the private sector. We have also said time and over there should be effective retention measures. Well, money-wise, we cannot compete with the private hospitals. However, there are several ways that we could retain nurses. First of all, there should be a reasonable ratio of nurses to patients. We have been asking for 1 to 6. We have to increase clinical supervision, and we also have to improve the administrative measures. Don't change the goalpost every time, because we know that the beds are not enough. There are also very cheap equipment, but the lack of such equipment is a big obstacle for frontline staff. What we are hoping is to provide professional care. Mr. Lau Hoi-man, for the Hong Kong professional medical personnel and nurses, I would like to speak on behalf of the association. We believe that the HA is empty talk and also top-heavy. I have said many times that there's an increase of 150% in the headquarters, which far exceeds the staff level at the ground level. Well, they explained it as an increase in the IT personnel. However, such an increase in IT has not been very effective to improve the work on the ground level. We, on the front line, for the HA or the HB, there is not much good connection between the HA and the various hospitals. The blame should not be all on the IT personnel. You should increase the frontline personnel, and so that you can listen to the frontline views. The management has had a great deal of increase in their remuneration. Well, there has been an increase for 3.6 to 6.6, whereas the CE has had an increase of about 8%. So we had a 4.6% for the frontline personnel. However, for the highest level, to 5 top level, they had an increase of 5.6% increase in salary. So there is a lot of deficits. So these high-level management increase has been greatly exceeding that of the frontline, and we are really indignant. Now, the morale is very low and the turnover is very high. 90% of the nurses, and they have a turnover of 7.6%. Well, the chief reason for their leaving is dissatisfaction and very harsh working situations. Now, the Now TV says that on top of the demand, we are now increasing 2,000 nurses. However, the recruitment should be shortened, and there should be a hike in the remuneration, and that the HA board should listen to the frontline personnel views. Mrs. Hong Oi-lan, the Sha Tin District Council member, apart from being a member of the DC, I'm also a member of the Pharmaceutical Association. I'd like to make several points. Public hospitals are taking resources from taxes. So the hospitals should take care of tertiary care and not primary care. So we should reduce paperwork and meetings in order to retain them. The government should work more on primary health care, while the headquarters enjoys a huge alliance share of resources. In the mainland, they are now shutting pharmaceutical department, allowing the pharmacists to do their job. Now we are facing increasing pressure in public hospital. We are talking about outpatients and also non-hospitalized patients. Well, for the well, the pressures that we are now facing have resulted in errors, medical errors. We have received a lot of complaints. I'm not pinpointing any hospitals. For instance, there are wrong medicine given to the patients and dosages. There are also errors of dosages or identification. In 2009, there are medication with bacteria. So, in fact, it is very worrisome. We can see that the PPP, the private-public cooperation, the outpatient should have pharmaceuticals being provided by the private sector, the pharmacist in the private sector. Well, we should not waste resources by keeping pharmacy in the hospitals. Well, for the elderly homes, you are adding their workload. So the HA pharmacists can concentrate on inpatients. For the HA services, they are now being cut off from one another. So we need to have community care so that they can pick up the lack.
Next, Mr. Li Meisheng from Hong Kong Medical and Health Chinese Staff General Association. Thank you, Mr. Chairman and senior staff members of the HA. The public hospitals have been taken over by the HA for 27 years. I think the management is poor. They don't care about the difficulties faced by different grades. For 27 years, we have not been given a proper pay scale. So the senior staff members got very handsome employment terms, but we don't. And for the latest exercise, the new recruits get a higher pay rise than the existing staff. It is a waste of human resources. I think whether we are new recruits or existing staff, we are the assets of the hospital authority. We should give them a standard pay rise. I don't think the government should, I don't think the HA should drive a wedge against us. We all want to provide better service for us at the front line. Even during the ordinary days, we have very overcrowded wards, not to mention that when we have a winter surge. For the frontline staff members like us, we hope that the senior management will not forget us. We did fight against SARS at the risk of our lives together with you during the SARS outbreak. Now, we have taken a pay cut and our pay levels have also been frozen. But you never consider us when you introduce a pay rise. Now, for the hospital authority, when you recruit staff members who have got 6 different titles, I got a 16.5% allowance when I converted from the government to the HA. Nowadays, we don't get any pay rise, and in fact, our incremental point has been cut by 1. We have TSA, CSAs, PC, A3, etc., etc. Whenever you introduce a new job title, you will reduce the pay point. You would also cut the employment benefits. But we are all serving in the ward. Now, for the hospital authority, we have got 7 clusters, and they have their own autonomy. And you have got 7 different explanations. You can never get any confirmation about any policies. Now, we are getting a pay rise for PCA, OPA, etc. We welcome the standard pay rise of 8%. We welcome it. But what about the healthcare assistants? What about workmen too? What about clerical officers? They have been with us for a long time. They undergo they were with us during the SARS outbreak, but they don't get a pay rise, so we are all very aggrieved. Yes, indeed, HCAs have written to me complaining about the HA. Next, Mr. Zhizilok from the Democratic Party. Thank you. I'm a member of the Medical Services Working Group. Now, the public sector of our healthcare system is very crowded. In 1974, there were 3.9 beds per 1,000 people. In 1989, an improvement, 4.4 beds per 1,000. Now, in 2018, it went down to 3.8 beds per 1,000. In other words, for our public healthcare sector, we are going back to what we used to have half a century ago. So you can see that we don't have enough hospital beds. Now, let me talk about the waiting time. On average, you have to wait for 109 minutes if you are secondary in terms of urgency. For UCH, 177. Non-urgent cases, 228 minutes is the time you have to wait at UCH. And in fact, during the winter surge, we were alarmed by news that people had to wait for 8 hours. I think we all know that for a new case, it is quite common to wait for 2 years. For those having an eye disease, it's outrageous. 3 years waiting time. It's as if we are in the third world country. We are a third world country. There have been more resources for the HA, and yet the level of service hasn't been improved. The DP has come up with the following recommendations. First of all, we need to bear in mind that we must provide reasonable level of service. We need to borrow the experience from Singapore. That is, we should have a list of medical schools. Now, if we believe that certain medical schools are credible, then we can exempt the graduates from such medical schools from taking a licensing examination. And then they should, our graduates should also remain in the public sector for 5 years. What we have seen is that for many fresh medical graduates, they serve in the public hospitals, and then they get specialty training. But after they have become specialist doctors, they will leave the public sector immediately. This is especially prominent in the case of eye care. So I think we have to mandate that they must serve the public sector for 5 years. And then for senior management members, they should cut down their managerial duties. They should reduce the time spent on attending meetings. In the long term, I think we should try to learn from the experience of many overseas countries. Many doctors don't have to take up administrative duties. The management duties are actually carried out by administrative specialists. I'll give the floor to Mr. Leung Kwok Hong, and then I will give the floor to Mr. Tam Mai Pong. I don't mind speaking at the end of the queue. Mr. Leung. Thank you, Chair. Let me, first of all, describe the current status of the HA. Well, they are the privileged class. They have a lot of papers. They have a lot of meetings. But at the front line, they are in deep waters. So, like in the mainland, many people have to attend numerous meetings. They have to deal with a lot of paperwork. Secretary, you used to be a nurse. What is your comment? For pay, well, for the front line, it is like they are fighting a war. It is like they are at the front line of a battlefield. They don't have any resources. But then for those in Chongqing, like during the time when we were attacked by Japanese, they had a lot of perks. And then they were also corrupt. Now, what I mean is that you get a pay rise, but then for your subordinates, they are burnt out, they have to leave. Just now, Ms. Pong said that she would like to thank the frontline officers for staying in their posts. You don't need to praise them. A lot of them have chosen to leave. Don't praise them because it is going to be counterproductive. Now, we have got CH Tung as well as Donald Zhang. Well, Mr. Pierre CHAN asked a question about the reduction in the number of hospital beds. It took place during the era of CH Tung, and he's the head of the One Hong Kong Foundation. At that time, he said that there was structural deficits. He said that there's no need to train nurses, and so many nurse training places were scrapped. Please watch your language. And then Donald Zhang said that we should privatize our health services. Well, the hospital beds were reduced in number, so there were fewer beds in the public hospitals, and so staff were discouraged from staying with the hospital authority, and patients were forced to go to the private sector to get medical services. So what places have you visited? Have you come back from the world of the deceased? Can you promise the people of Hong Kong the following? That is, why are you going to reduce the gap? Why are you going to remove the scenario in which you are you give more resources to your top management? Please make sure that you get sufficient resources to provide better service. As far as our GDP is concerned, we haven't got the reach to pay for the medical services. I think the government owes us the following. That is, the secretary should ask the CE to give you a better share of the GDP. You talked about $20 million. Well, I think the approach is wrong. Yes, calm down, please. Well, on my part, I've also asked a question about hospital beds. Indeed, there has been a decrease in the number of hospital beds. We have asked the administration about the following data. That is, between 1997 and 2017. We'd like to find out more about the cut in the number of hospital beds. Sorry, speaker is off mic. It doesn't matter. The next to speak, Mr. Men Yun is not in his seat, so I'll give the floor to Mr. Chow. Yes, thank you, Mr. Chairman. Well, there are different deputations here. Nurses, doctors are here. They will give you more details. Well, for every 1,000 people in Hong Kong, we have got round about 1.9 doctors, both in the public as well as the private sectors, a much lower ratio than those in advanced countries. And for nurses, again, we are 1/4 poorer in terms of our ratio. Well, I think in the HA's paper, I don't think we have got much information. I think the government would like to give us some token measures, like the drug formulary to be slightly enhanced, and then we have got the healthcare vouchers. Well, for money and hardware, I don't think they alone can address our problems. Just now, we have been told that we have got a new hospital in Kai Tak for children. They have commissioned the hospital, but then they haven't got sufficient manpower to run the service. In 2017, it was said that there should be 7.45 million people. But in fact, the actual number was 7.33. Had the government been prepared for population changes, we would not be lagging behind. I think what the government should do is as follows. let me sort of expand the scope of what I'm going to say. Money and hardware alone won't help us to address the problem. What is important is that you need to enhance the pay conditions of the public sector, healthcare sectors. Otherwise, they will all go to the private sector. More places at the tertiary institutions so that we get more graduates from the medical schools. And we need to get more overseas trained healthcare members to help us. And then we mustn't let long waiting time to turn away the patients. Nowadays, patients would just turn to the private sector when they find that the waiting time is too long or they just don't survive the long waiting period. I think the government shouldn't shirk the responsibility. The government can't adopt the approach that by turning away the patients, the problem has gone. And then for the district or community healthcare centers, I don't think they're actually providing primary care. It is more like a shopping center. So I think we should have a network of primary healthcare centers. We used to have outpatient clinics or evening clinics. I think that's better than the latest proposals. And then for long-term care and institutional care, currently we have got elderly people living at residential care homes. They haven't got any nurses helping them. So when they are not feeling well, they have to go to the A&E department. And it is a vicious cycle. So if the government does a proper job, then the disabled, the elderly, the children won't have to resort to the A&E department every time they are not feeling well.
Mr. Menyun, for the League of Social Democrats. No, I will follow the queue. The Supporting Staff Association of the HA, Mrs. Ng Wai Ling, would like to say that for the frontline supporting staff, we are facing shortage, manpower shortage. We have executive assistant, operation assistant, etc. Well, we have a very serious shortage of manpower, and we have increasing workload. This has been so for the nurses, and very often their work has fallen on this supporting staff. So we are facing a lot of work. We don't have enough people. And because the situation is so difficult that people leave, and for those who stay behind, they face a lot of fatigue, a lot of accidents, and a lot of application for sick leave. Well, in this case, those who are staying behind are facing even more workload. For the increasing remuneration, of course, we welcome that, and it will help recruiting new people. And for those who are staying at their posts, increasing the remuneration could be of help. However, for the supporting personnel, for those HCA or the level 2 workers or clerks, well, there is a contradiction between the old system personnel and the new personnel. Why is it that the newcomers have increased remuneration, whereas they have not enjoyed such hikes? Well, that would create a lot of contradiction and complaints. Well, I hope that the HA will recognize their contribution and will take them into account as well. I know that they don't represent a huge number. They are about 2,000. So could some improvements be made so that it could be fairer in such a way that they would stay in the public sector? Well, you have to restructure the deployment of manpower, in particular the ratio. For instance, there could be 2 staff facing 60 patients, a huge workload, creating a lot of difficulties. So our posts should be well defined, increase opportunities of promotion, and they should follow the civil service grades. Next, Civic Party, Mr. Chen Kin Yip. Thank you. I support the inclusion of non-locally trained doctors. Well, for instance, we are now facing imminent shortage. It's not only a problem of immigration. Well, the problem will still persist. Some people object to it. We don't want mainland doctors, which means that all over the world we do not wish to have any non-locally trained doctors. Do you mean that in order to not to import one mainland doctor, you are going to reject over 100 foreign doctors? I have one stroke relative who went to the public hospital. At that time, we were very anxious. It was a Friday, and the doctor would only come Monday, and we could only go Monday for inquiries. However, the situation was so dire, we couldn't have waited over the weekend. We were very anxious. We were completely ignorant of the situation. If there were a non-locally trained doctor that we could ask, then it would be better than waiting until Monday. Because even if it's Monday, you have an expert present, that wouldn't help much over the weekend. So very often the frontline staff have to face all the complaints. So when you are across the board rejecting all non-locally trained doctors, well, if you have a flu patient, he doesn't want to go to the A&E and he doesn't want to see any doctors. Well, then the contagion of his disease is such that it's spread all over. We should follow the Singapore practice that they should have limited registration for non-locally trained doctors. They should have 5-year service in the public hospital. The service there would help them to learn the local situation, and you can also see their performance. Well, that would be proof. That would be an assurance of their quality, and the non-locally trained doctors could then, through this approach, obtain qualifications to serve in Hong Kong. Mrs. Chubo, my phone number is 63552001. I am ex-HA worker. I worked in the Princess Margaret Hospital. I was SARS nurse, and I was community nurse, personnel as well. I would like to ask, do you have a complaint system existing, the HA? No, because if you complain, then they will take you to the mental hospital, and they will diagnose you as that you are not a mental disease patient, but you have a lot of dissents. You won't have any promotion. But I would stay on, but I have seen bullying. Well, my colleague, one of my colleague was indecently assaulted on the bed, and then afterwards she fell into a depression, and well, you should go to the police, I said, and well, I've been told to mind my own business, and in elderly home, Well, I was in my uniform, but the elderly was being abused. And my boss said that, well, let it be. Now, our community service has to cooperate with the elderly home. Well, I couldn't stand such a elderly abuse. I decided to go to the police. And that was the main reason I left. Well, I am doing my job, and my boss said that you are a trouble creator. Well, you are deteriorating the hospital relationship with the elderly home. I go to the elderly home to teach them to take care of the elderly. Well, so I decided to resign. So there was a month, and I could make things turn around. However, my boss pushed me and wanted me to recognize my faults. I fell, and I was wounded. Princess Margaret Hospital knew about this. Well, the reason was I was abusing the elderly, etc. So I was not being interviewed for the complaints. How could you treat your staff who had served 20 years? The reason for leaving was not the lack of promotion or for money. I had a salary of about $40,000. It was enough for me. You were saying that I was mentally diseased, but there was no such diagnosis. How? Right? You can submit a written submission. I have put a lot of documents to the HA. Mr. Len Chi-yo, Hong Kong Patients' Voices. We are talking about corporate governance. And first of all, I'd like to speak about the HA board. There are 30 members, of which there is only one member from the patients' organizations. There were no doctor nor nurse representatives. Apart from officials, I have seen that there are lots of members with medals from the SAR. I believe that they don't go to public hospitals. Well, for the medical council, you have included patients' representatives. And so there will be about 1/5 or 1/4 membership of the board that should come from patient associations. And also we should include nurse and doctor union representatives because they form a large part of the professional staff. I am also a STARS Association chair. Well, the doctors and nurses did not leave their posts during the SARS epidemic. Well, why do they leave now? Well, what kind of treatment make them leave? We just heard cases of bullying. Bullying is a very serious problem. Promotion is another, unfair promotion, and also the defective complaint system are also reasons for them to leave. If the top management doesn't know what's happening in the HA, then I invite them to go to HA Civis Facebook to see what are the complaints of this staff under HA. There are doctors who said to me that the senior management would enjoy bonus from performance. And I think this is a case of conflict of interests. Recently, the administration has been putting a lot of public resources into the private sector, for instance, medical insurance. Well, I'm afraid that if that succeeds, more and more doctors and nurses will leave the public hospitals.
Next, Mr. Lee Ka-ho from the Civic Party. Thank you, Chair. Well, the hospital authority has been set up for over 20 years. There are many problems with the HA. There was a review during the last term of the government. 2 years were spent on scrutinizing that particular review report. Well, in fact, the problems are obvious to everybody. Uneven distribution of resources, long waiting time, etc. 10 recommendations were made. 4 years have passed since the report has been published. But have we seen any visible improvement? No. Some hospitals may come under a different cluster, but the problems are still with us. You have to wait, and in fact, the waiting time is even longer. Now, our public healthcare sector, what is the problem? Well, you don't have enough staff, you don't have enough resources, lack of manpower. Well, I think you know that it is very acute at the front line. The frontline staff are getting a heavier and heavier workload. And in fact, every year when we have the peak season for flu, the hospitals are bursting at its seams. And then, in fact, we were told that at an A&E department of a hospital, the waiting time was 8 hours. And then you have to increase the beds in the corridor. You have to set up beds in the corridors, etc. And you can't even walk through the corridors. And in fact, the usage rate was as much as 130%. Even in ordinary times, the utilization rate is 100%, and you used to have to wait at the A&E department. And that's why the doctors and nurses are having a lot of stress. Just now, we were asked to visit the HA Secrets webpage. When the pressure is too much, then you want to quit. And we have been told that last year, the wastage rate for doctors was 6%. The highest in the past 10 years. In some departments, it was as bad as 10%. If the HA is not going to address the problem of low morale and a lot of stress, then I don't think you can really achieve any improvement. Even if, say, for example, if you get 100 non-locally trained doctors for Hong Kong hospitals next year. So for a long period of time, hospitals are overcrowded, the stress is unbearable, and so there are many problems that are plaguing the HA. I think the HA must come up with a review of the governance, whether the funding model is good and whether we can address the problem of different clusters being autonomous clusters. And then please look at the future demand for hospital beds. You have to carry out a review. Thank you. Next, Mr. Ngajan. Thank you, Mr. Chairman. Like others who have spoken, I want to say that we have an acute shortage of manpower at our hospitals. I hope the HA can allow more non-locally trained doctors to come to Hong Kong to work. Well, it is a simple point. When there's an increase in demand, you increase the supply and then the equilibrium will be restored. Just now, we have been told that the government is going to recruit non-locally trained doctors. But how are you going to attract them to come to Hong Kong to work? The current system is such that non-locally trained doctors, they have to take a licensing exam, and it's quite difficult, and they have to undergo 12 months internship. It is a waste of time for many of them. They would rather stay overseas. And then for fresh graduates, graduating from overseas medical schools and prestigious universities, we still have to take that exam, and the pass rate is very low. I understand that the exam is very difficult. For many overseas trained medical graduates, they would rather stay overseas to practice than come back to Hong Kong to practice as a doctor. Like others who have spoken before me, what I want to get is that there should be a rationalization of the system. We can borrow the experience of Singapore. That is, we should come up with a list of accredited or recognized medical schools, like in the for those who have graduated from medical schools in the USA, the UK, and Australia. I think they should be admitted without the need to sit an exam. But of course, we mustn't let them go to the private hospitals. So for those returning from overseas, they should be asked to stay with the public hospitals for a period of time. Just now, the suggestion was no less than 5 years. I think it is reasonable. So I hope the HA will adopt my recommendations. Thank you. Next. Hong Kong Non-Emergency Ambulance Transfer Services Staff Association, Mr. Zhang Ginguo. Thank you, Mr. Chairman. Good afternoon, ladies and gentlemen. I'm Zhang Ginguo, representing the Hong Kong Non-Emergency Ambulance Transfer Services Staff Association. Let me tell you what I want to say. We have got very limited promotional prospects. For PCA3, if you want to get promoted, the HA has asked us to get a driving license. For PCA2 to become a controller, there are only a few promotional posts. And in other words, it takes a long time to get promoted. And for the majority of us, we don't have any reasonable promotional prospects. So I think we should have something similar to the case of the PCA3A, so that whenever you have worked for 3 years and having passed the appraisal, you'll become PCA2. Now, we have only got an increment of 2.5% per year. So on average, it takes us 10 years before we reach our maximum pay point. As a result, many of our colleagues would rather go to non-government organizations, private hospitals, or the homes for the elderly. So I think we should make a change. The incremental point should be between 5 and 10%. And then instead of having to wait for 10 years to get to the maximum pay point, it should be 3 to 5 years only. And then we have to work under very extreme and unsatisfactory weather conditions. And we have to engage in a lot of manual work as well. However, we have the same pay level as those working in hospital wards. But in fact, our job is more onerous and there is a degree of risk, so we should be given a special allowance. And fourthly, retirement age. I hope the retirement age will be extended from the current level of 60 to a more senior age. Currently, you have to apply again before you get an extension of 2 years, and if you want to have 2 more years, there's another mechanism to go through. So why don't you follow the practice in the private sector? When you reach the age of 59, you'll be offered the chance to extend the retirement age to 65. In fact, we are a very special grade, and we are also involved in rescuing work. I think it should be removed from the supporting staff grade. We should have our own grade. And then for CA and PTA members, many of them are disappointed because they are not covered by the pay rise. So please consider giving them a pay rise. Thank you. Next, Mr. Kwok Wai Sheng, officer of the Shek Kip Mei Estate Residents Association. I work in Shakit May, so I will focus on the case of Shakit May. Now, I just want to talk about the outpatient clinic at Shakit May. Well, at long last, we are able to get a proposal about the redevelopment of the outpatient clinic. And then there will be a seamless transition. There will be a provisional healthcare center at Block 6. So there will be a general outpatient clinic there. And I hope that the HA will take this opportunity to do the following. Please provide more manpower so that you can provide evening service as well as service over the weekend, because our residents do need such service, during such hours. For Sam Shui Po, it has a lot of grassroots people. There are many elderly people, but we've only got evening service at Cheung Sha Wan Clinic. For weekend service, we haven't got any weekend service in the entirety of Sam Shui Po. Now, I would like to ask the Bureau as well as the hospital authority. We have got such a large population, and yet we have only got one evening clinic and no weekend clinic. Is it reasonable? If somebody falls ill in the evening or during the weekend, then all they can do is to pay a lot of money to see a private doctor. For those who can't afford it, they have to wait and wait for a long time. But by the time it gets to their turn, his conditions might have worsened and he has to be admitted to a ward. This is only adding to the workload of the public hospitals. So it is a vicious cycle. Without evening service, without weekend service, it means that people are forced to queue up at the A&E department. In fact, for Shakit May Estate, we have got 10,000 households. Soon, we are going to have another 1,000 residents moving in. So, if you don't extend the service to the evenings, to the weekends, then it means that we are not going to have our needs met. And both the residents as well as the healthcare professionals will suffer. Well, you know that the population is aging. The A&E departments of the public hospitals can never catch up with the increasing demand. So I think it is right to have evening service at the outpatient clinics. It can address our needs and it can also ease the demand on the service of the A&E Department of Hospitals. I think this is good for the government, good for the staff members as well as the residents. Now, the SFH would like to boost primary health care. So I think the Secretary should talk to the hospital authority, and we should make sure that for our general outpatient clinic in Shakit May, you should introduce evening service and weekend service. Thank you. Next, Mr. Lee Man Kin. I'm from Yau Chun Mong district. I'm from the grassroots. Many people have already talked about the problem of manpower shortage. If I may also tell you what the people in Yau Chun Mong think. Well, in January, as I think you all remember that it was the peak of the winter surge. A lot of us would like to get an appointment to see a doctor. Well, we are an aging community. We've got many residents above the age of 65. Even when they fall ill, they can't afford the doctor's fees in the private sector. And then it means that they don't want to part with their healthcare vouchers easily. They have only got a limited number of vouchers, and they will try to get an appointment at a nearby hospital. They will try to get an appointment from Kwong Wah Hospital, but they won't be able to get a slot even after ringing for 2 days, 3 days. So usually they have to wait for a day or two before they get to see a doctor. In other words, is easily 5 days later before after the onset of illness, then the patient can see a doctor. Now, to our surprise, we were told that the total number of appointment places is 130 only, but I just wonder whether it is adequate. And I want to know why we can't provide more service. If Kwong Wah Hospital doesn't have the capacity, what about Kowloon Hospital nearby or the Queen Elizabeth Hospital in the same cluster? I think we should divert the patients, and there should be more information to let the patients know. In 2024, QEH will be reprovisioned, and it will be proficient in Kai Tak. Now for Kwong Wah Hospital, yes, there is a redevelopment project. There will be more hospital beds. But then I think the biggest problem lies with the A&E department. Well, there was this patient who told me about his experience. I understand that after being screened, he might not be the most urgent case, but then he had to wait for 8 hours. Of course, you have some emergency, and that's why you go to the A&E department. It is unreasonable to make somebody wait for 8 hours. I think he should have been sent to another hospital.
Well, you are talking about a serious shortage of manpower. Why can't we readjust the remuneration? Well, the grassroots staff are not enjoying as much salary increase as the top management. So they should receive reasonable remuneration. Now, you have internship. Well, for Singapore and mainland, they would need exams to be passed. So we should perhaps have interns to help us. That's all I want to say. Thank you. Remuneration, well, these the subsidized staff cannot exceed that enjoyed by the civil service. Mr. As the Hong Kong as the highest longevity, well, that has a lot to do with the very good medical service, public medical service that we have. And it is also thanks to the commitment and loyalty of our medical personnel. I'd like to thank the HA as well as the selfless sacrifice of the medical personnel. Well, because of the aging population in Hong Kong, adding burden to the medical service, we hear every day that there are long waiting queue hours, as well as the critical situation of the hospitals, and as well as the low morale of the staff, and also staff leaving. Well, shortage of manpower is a fact. As for doctors in public hospitals, since they have a lot of work, many doctors cannot even eat properly or have their meal times delayed. Well, doctors are professionals that we would support, and we hope that the authorities concerned will do more for non-locally trained doctors with respect to their LR, to their internship, or to their these exams that they have to sit. We hope that solutions will be found in order to ease our situation. There are 1,000 nurses who left, and over 90% are fresh graduates. So the HA should look into the matter and improve the management system. And we should have more pharmacists, as well as setting up a pharmacy system. As for the high prices of drugs, resources have been allocated. Well, there should be lowering of thresholds for the Community Care Fund and Samaritan Fund. And I hope that the HA and the administration are doing a lot to issue medical vouchers, for instance, and to enhance preventive and self-care measures. And I hope the HA management will have new ideas to enhance the structure and will take into account the views expressed by the public to build a better future. Dr. Pong Chiu Fai, we all know that there is a crisis, and from the studies that in 2030 we will be short of 1,000 doctors, etc. Well, if we say we have to say that the public hospital doctors are taking care of 90% of the patients, while there are only 50% of them. So, well, we can see that there is a very severe imbalance, and imbalance between the private and the public hospitals. Well, we now see that the wastage rate is high. The ophthalmology is the highest attrition rate. We can see that there is a lack of training resulting from the wastage, and that will adversely affect the whole of the medical service provided. Increasing places for doctor and nurses training, we should also raise the remuneration for them. We also have to review the promotional pathways. While a retention measure should be a win-win situation, well, perhaps in the beginning we could allow them to have part-time work. Well, we increase the cooperation between the private and the public sector, particularly for ophthalmology or oncology. Well, if we have to wait a long time, they can go to the private market, private hospital, so that we can have they can enjoy collaborative consultation service, first in the private clinics, that the patients can swiftly consult and reduce the waiting time. We can enlarge such collaboration. We should reduce the threshold for non-locally trained doctors. Most people would say that the Commonwealth of doctors should sit for exams before they can be qualified. However, we should review the threshold, and we should appropriately relax such requirements. Many doctors would agree doing away with the internship, but the requirement is to stay in the public hospital for 5 or 6 years. Well, if we can predict the upsurge in the flu season, we can have some work transferred to the private sector. For instance, we have electronic technology to reduce the administrative workload. Mr. Lai Chun-kin, health in action. Well, we have to prevent the health problems of minorities. In Hong Kong itself, I'm afraid that the health authority has been rather slow in dealing with the problems of the medical service. Aging is a problem. However, does it mean that age would lead to ill health? Is that a fatality? We have to know whether there is an increase in the trend of consultations, of patients consulting. For instance, 2.2 million. Well, for housing, for education and water supply, these are all public measures that could affect their health. But we do not see the links between these spheres of these measures with their health measures. Very often, the public accumulates health problems leading to chronic diseases. Well, if you have you done a lot of work in preventive medicine, or are you letting them fall sick and treat them? There are lots of resources being put into the healing of diseases. Why can't you take into account health as a whole in the other spheres as well, so that health service is interdepartmental undertaking, and that is a long-term solution to the medical service, because whatever resources you allocate to the hospitals, it will still be in crisis. Even if you increase the salaries, they are still working in dire situations. Now, there are nurses and there are pharmacists and there are physiotherapists from public hospital leaving the public hospital, going into the private hospital. They don't have time. They can finish a meal in 10 minutes because they don't have enough time. They don't have good conditions for taking a meal. And that is why they are complaining that they are eating the same things from the canteen. So for them, their health is also at risk. There's no guarantee. So the demands on them are rising all the time. So in the social security and in other departments, they should come together to promote health as a whole. I come from the Labour Party, Mr. Kwok Wan Kin. We have been talking about the private-public collaboration. Since there's a lot of shortage in the public hospital, and you are going to develop the private clinics, they are linked together. Very often, it is the private clinics that are snatching medical staff from the public hospitals. Well, you are encouraging them to go to the private hospitals, which means that more and more would go to the private hospital. For the 2030 strategy, from 2020 and 2021, there would be a very big shortage of doctors, and we cannot meet the demands of nurses in 2020. And at the same time, the private medical service is flourishing, and we can see further down the road a more severe manpower shortage. So you know about this in 2000. You knew about this in 2017. Why is it that you are still encouraging the private clinics? For instance, the Guangyi Hospital, it is very expensive. The Gleneagles and the Chinese University will also have a private hospital. They said that it would be less expensive, but that aggravates the shortage of medical manpower. So for grassroots and for the middle class, are they going to stay queuing up in the hospital, public hospitals? Those who can afford medical insurance, they could enjoy the choice of going to the private hospitals. If we don't have a comprehensive medical service for all, we are still pushing patients to the private clinics, and that will aggravate the shortage of manpower. Well, these problems are really because of the inappropriate measures taken by the administration and the HA. You have mentioned the reduction of number of beds or the reduction of doctor students or nurse students, or the pushing of golden handshakes. Well, you are a lot of experienced medical personnel had left. And today, we are shifting the focus, saying that it is the problem of aging. However, the whole planning was wrong, and who should be responsible for that? Well, nobody would be responsible for such a state of affairs. Little BB Concern Group, Mrs. Jamie.
Thank you. I represent the concerned group as well as their parents. I'm an ordinary citizen. Well, we've collected the views of the stakeholders as well as their parents. Well, we are concerned about the problem of lack of sufficient resources, the hard work of the medical staff when it comes to fetus that doesn't survive 24 weeks. Well, there have been a lot of grievances and there were lots of complaints. Well, we are an ordinary citizen. We are a user of the hospital service. Well, of course, the G&O department is a very important department. If something goes wrong, then the baby will be affected for life, and even it will take away the life of the mother. Now, we haven't got sufficient hardware, we haven't got enough beds, and I've been told that there was this expectant mother who went into labor during the small hours of the morning, and then about 10 mothers were waiting, and yet there was just one midwife. In other cases, you can wait, but for a mother going into labor, you can't wait. And then the mother told me that the nurse was examining one after another, and the nurse was deprived of sleep, and she had a very good attitude, but that's all she could do. And as a mother, she could only take it and be patient. Now, of course, we have a problem with manpower in the HA. For ordinary citizens like me, I think we're anxious. We hope that our healthcare service can be improved. Now, for the A&E departments, they are all bursting at the seam, and we need to be resolute. We need to have better manpower planning, fewer meetings, and then there should be more resources. You should act in a determined way. But of course, there are also other more deep-rooted problems, and that's at the core of all the problems. Just now, Mr. Chang made a very good point. That is the Association of Hong Kong Nursing Staff Representative. We've only got a limited supply of professionals. I think it takes many departments, many bureaus in the administration to come up with better manpower planning. The society of Hong Kong has an aging population. We have got a demographic structural change, and the mainlanders come to Hong Kong to see a doctor. So we are merely ordinary citizens, but we do hope that the government should come up with long-term manpower planning. Thank you. Thank you. Next, the accountant of Baby Concern Group, Ms. Lee. Thank you, Chair. Thank you, members. Many speakers have already spoken, and I agree with a lot of them. I think we want to have a healthy and harmonious society. The population is growing. The average age is also increasing. We all know that the hospitals are very crowded, and you only have a short time when you see a doctor. When you have to wait for a test, an exam, a surgery, you have to wait for months or even years. So you can see that the workload of the medical staff and healthcare members is huge, and they're under a lot of stress. So I think it's better to take out preventive efforts. Well, of course, the administration has come up with a good program so that we can have coloscopy. I think in future we should also subsidize citizens to go for gynecology tests, cataract tests, etc. And then for the support to family members of aborted fetus, I'm afraid we've overlooked their needs. I hope that the Department of Health can fill the gap. There's also one other point, and I hope that the government should be asked to provide more resources to the DFH to cover the following areas. First of all, long-term planning for healthcare, expanding the hospitals, more facilities, and then training of the healthcare professionals covering different disciplines, GNO, neurology, the cardiology, etc. And we should have more advanced equipment for test, examination, and treatment. And the three of them go hand in hand. We need to redevelop and expand the hospitals. You need more manpower. You will need better and more equipment. And fourthly, for the family members of the aborted fetus, I think they need a lot of emotional support. They were expecting a new baby to be born, and yet it has a sad ending. So I hope you can try to help them so that they can overcome the sadness. And then they can sort of pick up themselves. I think this will be good for the society as a whole. Finally, the HA, the DFH, etc., I think you should work hard to enhance the health of the citizens, and then we don't have to suffer from illness. Please enhance the quality of our healthcare service. It will be good for everybody. Thank you. Next, Dr. Lam, representing the HA Workers' General Union. Thank you, Chair. I think we have a very high attrition rate. This is because there is a very serious problem of bullying. Then a teacher committed suicide, and our attention has been drawn to the bullying by school principals. I think we have got something similar in hospitals. The executive directors have the power to bully their subordinates, and they are not disciplined. So for the frontline staff, they don't have a choice. All they can do is to write an anonymous letter to the media or go to HA Secrets to expose the problems or air their grievance. Now we have got 70,000 employees with the HA. HA Secrets has got 50,000 members. With so many staff members choose an anonymous channel to air their grievance, it means that bullying is a very serious problem. Unfortunately, for bullying at workplace, I think what is at stake? I think the patient care is at stake. Let me cite an example. According to a report from Hong Kong 01, for NT-East cluster, the attrition rate was 10.5%. 25 doctors left their medical ward, and it has dealt a grave blow to that cluster. Well, there were doctors, frontline doctors, who didn't attend enough meetings and was accused of poor performance and was made to undergo disciplinary action. And then there were others who were made the subject of internal investigation. A doctor was accused of having problems with his ethics. And what is outrageous is that for this particular cluster, the doctor involved was never given the justification as to why disciplinary action was taken. We turned to Dr. Yin for help, but eventually the matter was referred back to the reference cluster for action. So you can see the difficulty faced. I think the difficulty is as bad as that faced by Miss Lam, the teacher, who eventually took her life. Now, I think the school management committee is like the governing committee of hospitals. Frontline medical staff, like frontline teachers, are at the mercy of those who are in power. I hope Dr. Lam, the Chief Executive of the Hospital Authority, can give us an answer for the bullying culture practiced by the senior management. And the senior management have been imposed on us, and as a result of what they have done, many people have chosen to leave, and this is being done at the expense of the patients. I want to know whether the HA head office would choose to turn a blind eye to the bullying. Thank you. Next, Mr. Nguyen Guan from CTU. I'm from the CTU. I'm also an officer of the trade union involved. I have written to Dr. Yin and one other senior management. Many colleagues have to ask us to air their grievance on their behalf. Well, bullying at workplace. A nurse told you her story, and it was a very serious case. I've also heard from many colleagues, and it was really prevalent. Let me cite an example. Last year, there was a family doctor in Island East. He parked his car in the wrong spot, and then there was an investigation committee to look into the matter. So the whole thing was escalated to an investigation. Well, is it a matter of ethics? Is it a matter of professional standards? Had that been the case, I would agree, but it is a matter of parking in the wrong slot. And then I can give you another example. Again, it is awful. The doctor involved was asked by his senior to face an investigation committee. It was said that he omitted to fill out a form when it comes to drug administration. So he was asked to give the names of patients who have been given a particular kind of medicine since a long time, many years ago. So I think it's clearly a case of bullying at workplace. For 8 years, the doctor has been prescribing the medicine. There was no problem at all. All out of a sudden, 8 years later, it was said that an investigation would be needed. So it is blatantly a case of bullying. There's a lot of administrative work. A number of members have to be asked to join the panel. So many people leave not because they can't take the workload, it's because of the low level of morale and their grievance cannot be addressed. So it's a matter of serious problems with bullying, and then all the patients have to suffer.
This investigative committee is a weapon to target someone that the boss doesn't like. So apart from the ethics, well, the investigative committee, the power lies with the boss. So there is no, the Human Resources Department is only rubber stamp. The Human Resources Department doesn't monitor whether such an investigation is reasonable, whether it is a means of bullying. So we should also look into the trade union representative. There is a reason for bullying because the trade union representative or a colleague cannot accompany staff to a complaint case. This is unfair. So when there is a complaint, there should be a trade union representative accompanying the staff so that the complaint can be dealt with fairly. The Hong Kong Stroke Association representative, Mr. Lau Kim Hong. Recently, we have a problem of manpower shortage in the public hospitals. It's bursting at its seams, and there are medical errors. So we are much worried about such a situation where patients cannot be treated appropriately and in timely manner. Now, there are remedial measures, for instance, in recruiting more non-locally trained doctors, retired rehire, and also local regional medical centers, etc., in order to relieve such a dire situation. However, what we are mostly worried about is the wastage of experienced doctors. Have the authorities faced squarely such a problem? Are there measures or solutions envisaged? For instance, the UCH, there are 4 experienced doctors leaving. So it would seem that the situation is deteriorating. The wastage of doctors in public hospitals, this situation is getting worse and worse. There are doctors who work 20, 30 hours, and very often the lack of rest lead to medical errors. Have you taken effective measures? Very often you haven't, but would lay the blame on the staff. And there are no support to this support to these staff, and it is really very disappointing. Some medical staff would say that apart from meetings, there are lots of administrative paperwork to be done, and they have to face general outpatients, and very often they are just distributing drugs only, and they cannot really give their special expertise could not be used. And very often there are silos in the medical structure, and frontline doctors could not be promoted in an appropriate manner. You are talking about the big Bay Area, but you are saying that we will not encourage the professional doctors and nurses to go to these places. However, if it proves to be attractive, well, I'm afraid that there would be a wastage or outflow of medical personnel. Mr. Tam Hoi Pong, First of all, if you don't reduce the 151 one-way permit immigrants, well, you have 1.9 doctors for 1,000. You have 50,000 immigrants. Then you have to increase a lot of doctors. And the nurse ratio to patients is 1 to 27. If with the 50,000 immigrants, you would need 400 nurses added each year. Well, according to Article 42 of the Basic Law, Hong Kong administration can also voice their opinion with the one-way permit. Shouldn't we try to say and float the idea of reducing the number of one-way permit immigrants? We have the MTR, the hospitals cannot deal with such an influx of immigrants. So we are now bursting at the seams. The chief executive, why is it that there are 50 million medical expenses that are not paid? Because there are 7,800 cases a year where the medical expenses have not been paid. Well, for non-emergency cases, then they have to pay before care would be given. Well, for emergency cases, we have to treat them. However, for non-emergency cases, shouldn't they pay upfront? So you should not allow that medical personnel have worked very hard and all these people could go away without paying. So this is a way of dealing with the matter. Public and private hospitals are linked together, in fact. I discovered one thing. There are lots of mainlanders in the private hospital because there are insurance policies sold by the Hong Kong insurers to mainlanders, and they come to be treated here. Well, I have subsidies, medical subsidies. I go to private hospitals, and I can see that there are lots of patients speaking Mandarin. So, in fact, private hospitals are not really treating a lot of Hong Kong patients. As for the private hospitals of the Chinese university, that should be limited to Hong Kong people because it is on the East Rail, and I'm afraid that it will become a hospital for mainlanders. Mr. Wen Yun, the League of Social Democrats. Well, we have a problem, medical problem, that we have a problem of medical service quality. Well, this is not the case. If you have money to buy insurance, you can go to the Peak Hospital for to give birth, and you can go to the Adventist Hospital, and you can use the Uber. Well, the service is excellent. Well, for the medical personnel, well, we are richly paid, and the conditions are good. However, we are not talking about rich people's medical service. We are talking about public medical service. Well, the HA needs a comprehensive reform. Frontline personnel demanded that. However, that is not the crux of the matter. We should look at it from the whole. The medical service is a sinking ship. Now, the key is an over-reliance on the private market. Or, well, Mr. Zheng Yum says that it is a medical business. Well, for the public hospital, whatever resources that you have, you would not have enough resources. You will not have enough manpower nor equipment. So we live in two different worlds as far as medical services is concerned. So we need to have a whole-scale reform. We should put emphasis on prevention. In the 18 districts, we should have a polyclinic, an outpatient, or a medical health center. So they will be stationed by family doctors, that they would have a long-term service to the needs of the people. At least you should train outpatient doctors so that they would serve as family doctors. Well, as for the manpower shortage, well, if for the universities, for instance, if you rely on their reputation, you can receive them as qualified doctors without passing exams. Well, if you do not monitor or regulate the private hospitals, well, there is no place on earth where you earn as much as a Hong Kong private doctor. So it is not focused on the patient. It is not focused on the Hong Kong people. They are now only trying to make money. So if you want to talk about medical resources, if you only focus on immigrants, it is entirely wrong, and it is complete ignorance of the present situation. For professionals, you need to have a determination to reform. Mr. Kwok-Win, well, we are now facing a medical problem with a lot of reasons. Well, some would say that it's because of population coming from elsewhere. Well, that can be predicted. For the resources, for planning, the administration should be able to deal with such a thing. So I think the responsibility lies with the administration. Well, recently, I went to the Prince of Wales Hospital. I waited 6 hours before I could see a doctor. And before I get to a bed, hospital bed, 10 hours have passed. Well, I'm just one example. I can see old people. They are very unhappy. They don't want to stay in the hospital, and they would make a lot of noise and complaints, and it is very hard on the person who accompanies them. Well, I quite agree that there is a manpower shortage. There will be 30 million dedicated to relieving that. Well, for international standards, the nurse-to-patient rate is 1 to 6. Would you promise that this is the target? Don't give us very vague promises of so much and so much money dedicated to the flu, etc., etc. Are you doing it piecemeal, or are you stating clearly to the Hong Kong people what is your plan? You should try to converge with the international standards. We are now having a nurse-to-patient ratio of 1 to 11, or even up to 30. A consultant doctor said that, well, we don't have enough doctors, so that we can't spend a lot of time with the patients. Well, they need to attend meetings, etc. Well, for the doctors, well, I see you for 15 minutes or 10 minutes. Why don't you go to why don't you be hospitalized? Well, if they release the patients, there might be responsibilities that they have to shoulder. So that is why you have over-occupancy. Well, Mrs. Sylvia Chan, you have to tell us clearly what are the allocations, and particularly for grassroots primary health care, For instance, for the emergency ward, I can see that 7 out of 10 waiting there are elderly. Lastly, the baby boomers, they are now getting older and older. Well, in such a situation, when you allocate resources, you should not give all to HA. That you should also give resources to the primary health care. We are now exceeding our time slot. Another group of deputations are waiting. So I'm sure that it is a rare chance that you come. So I'd like to invite the officials to respond to your presentations. So I will also let the members to speak afterwards. Maybe the officials can respond.
Thank you. Thank you, Mr. Chairman. I would like to thank the participants who have given us a lot of comments. You told us the problems that you face today. It may be your personal experience, or it may be your observation of the problems at the hospital authority or those faced by the healthcare professionals. Now, for our policies, let me start with the Bureau. On the one hand, we have to enhance the system. We know that the population is aging and would like to provide a safety net to our citizens. Therefore, we must boost our public healthcare system. Just now, you talked about resources. In the past 10 years, for the subvention given to the hospital authority, it has been increasing. For the past 2 years, we have started the triennium funding cycle. When we give our subvention to the hospital authority, it will be easier for them to plan for their services. Of course, hardware and software go hand in hand. A lot of you have talked about the hardware in terms of the $200 billion and $300 billion 10-year hospital redevelopment programs, and they are going at full steam. Many more hospital beds will be added, both under the first program as well as under the second program. Manpower is the most acute problem. Many of you have commented on that. Yes, we have a manpower shortage, and we have to solve the problem at root. Increasing the number of places for medical students will be one of the solutions. For the administration as a whole, we have to attract non-locally trained doctors. We hope that they can come back to work here. But then if the working conditions are not improved, then it would not be attractive. At the same time, we can work on other fronts. Earlier on, we have said that on the 4th of March, we had meetings with major healthcare groups. We would like to work hand in hand. We would like to see how we can address the manpower shortage. We hope that non-locally trained doctors, if interested to come back to Hong Kong to work, of course, currently they have to take an examination. We would like to see how the system can be more facilitating. We'll continue to work in that direction. We know that some doctors are in support. In fact, the Hong Kong Medical Association has issued a press release. They are saying that the internship can be scrapped, but of course, subject to certain conditions. We'll continue to work with them on that front. Mr. Chairman, allow me to make 2 more points. Long-term manpower planning. I agree that it is really important, and we can look at it at 2 levels. At the Food and Health Bureau, we have embarked on long-term manpower planning. And for the hospital authority, again, they have long-term manpower planning for doctors and nurses. And it is hoped that we can better meet the demand for more manpower. Well, as to how they can retain their staff members, so retention strategies. Now, Chair, perhaps you can invite the hospital authority to give an answer. We have provided resources to them, and they're also devising different initiatives. Let me also comment on the public-private partnership. there have been calls to ask us to have more collaboration between the two sectors and divert more patients to the private sector. But then this is also a challenge. We can't lose the balance. Well, if we cannot increase our manpower drastically, then it means that we have to cut our load. Therefore, we must work in the direction of public-private sector partnership. However, if we move too quickly and if the scale is too large, again, this is a challenge because the private sector is booming. So we have to keep in mind the need to strike a balance. Finally, hospital authority, corporate governance. Just now, some speakers talked about their membership as well as the question whether there are staff representatives. Indeed, there are. Let me clarify that point. It was also said that the senior management of the hospital authority take a bonus. I have already clarified this point many times. No, they don't. And the hospital authority has said the same as well. They are under the hospital authority ordinance. Cap 113. Under the ordinance, they have to make use of their manpower, clinics, and hospital beds in the effective way so as to provide quality care. So the hospital authority has the board to oversee the management of the hospitals and to discharge the statutory functions. Thank you. Well, indeed, it is difficult to finish in 3 minutes. What about the others? Maybe Dr. Lam. So again, 3 minutes for you, a test for you. Thank you, Mr. Chairman. I would like to thank the participants for their submissions. Manpower is the most acute problem. As far as resources are concerned, we're grateful to the administration for providing the resources to us. Manpower is a long-standing issue. Many years ago, we cut the number of medical students, so there were fewer graduates. But recently, the number has been increased. So in the long term, there will be an increase. Well, a few years back, we already spotted the problem of manpower shortage. Therefore, we approached the Medical Council to apply for doctors to be admitted under limited registration. We believe that the restrictions can be relaxed. We'll continue to take up the matter with the Medical Council, hoping that there will be further relaxation and then we can get more doctors. And in future, we hope that there will be more medical graduates and they can help us. And then we have the retire and rehire scheme, and we have also got flexible working hours. For staff members' aspirations, when we are comfortable with the resources, and in fact, towards the end of 2019-2020, for the nurses and supporting staff, doctors, and allied health professionals, we would like to provide more promotional prospects and would like to address their concerns. But then the private sector is providing a very handsome pay, and what we have to do and what we can do is to improve the working conditions, provide more training so that we can keep our staff members. Some others have also mentioned about complaint cases. Yes, they have to be handled in a fair manner, but I won't talk about individual cases. For the complainant as well as those who are the subject matter of complaints, they should also be given a fair treatment. We do have an existing mechanism. And then let me also answer the question about default in payment. All of them are A&E cases. For specialist outpatient clinics, generally speaking, we don't see non-eligible persons. Usually is within the A&E department. I think you understand the statistics. As I have said, well, for bonus, for staff members across the board, including the executive staff, we are under a pay scale. So there isn't any component of a bonus. Every year, we make adjustments to our pay in accordance with the government's pay adjustments. So it is not true to say that individual staff members have their own pay scales. I hope you will understand this point. That's all I want to say. Thank you very much. You have managed your time limit very well. 4 members would like to speak. I draw a line. I will be strict with the time management. Some deputations have been waiting for quite a long time. Alice Mack, Poon Siu Ping, Ann Jang, and Chan Ho Yan in that order. First of all, Ms. Alice Mack, 3 minutes question and answer. Please switch on the mic for her. I will try to ask a question, and I welcome a written answer from the Secretary. It's better to reduce it into writing. Well, the supporting staff had a number of meetings with the HA, and so eventually there was a standard pay rise of 8% for the PCA, OPA, and EA Level 3. But then for those recruited before year 2000, HCA, Workman 1 and 2, etc., they won't benefit from the latest pay rise. And I hope that the hospital authority would consider their pay. They have been working for you for a long time. Please don't do anything that will affect their morale. And then I hope the HA would stop relying on agencies. I don't think they can really help you much. They will simply satisfy the headcount requirement. Instead of paying the agency, why don't you give a pay rise to your staff members so that it's easier for you to recruit staff and easier for you to retain staff? You can't have more staff members by asking agencies to help you. Well, the agencies can only produce headcounts for you. And then for the Medical Association, I think they have said that they agree that overseas doctors can be admitted to Hong Kong and internship can be waived. Now that doctors have agreed to have such an approach, so will the administration introduce this as soon as possible? Will you do it in the hospital authority as early as possible so that we can get overseas trained doctors? And then blame culture, bullying culture have been mentioned. And then for Dr. Ko, we spoke with you for a long time, and we've already told you that such a bullying culture has discouraged your staff members, and they have suffered in terms of their morale has suffered. Well, they have been made the subject matter of complaints and they have been bullied. So 4 questions. 30 seconds for you, Secretary. Maybe you can give a written answer. Well, let me talk about the dispensing with the internship. Well, we have been taking up the matter with different medical associations and bodies. Now that the Hong Kong Medical Association is in support of waiving the internship, it means that we have to approach the Medical Council to make some changes. Can I ask others to answer the other questions? 8% in agency. Well, for supporting staff, well, there are staff members under the old system. Well, in the third quarter, we're going to cover them as well. For the pay scale and the pay conditions, yes, the PCAs have a slightly different package. For nurses supplied by agencies, well, in some other hospitals, I think the staff feedback has been quite good. The problem we have is that we can't get enough nurses. Now we have introduced the locum arrangement. It's not just confined to nurses. I think even for your supporting staff, you have also engaged the agencies in both cases. Well, I hope that by increasing the pay, we can get enough recruits and then we don't have to rely on the agencies. Of course, if the outcome is not good, we will follow this up. Mr. Poon. Thank you, Chair. Thank you, Chairman. I would like to thank the deputations for attending the meeting. For the HA's governance and the manpower situation, well, in fact, this panel has always been concerned about the topic. A lot has been said today, and I think that the Bureau should address a number of issues here. $700 million has been given to the hospital authority so as to address the manpower situation urgently. A number of measures have been recommended. I know that on the 1st of April, you are going to introduce an 8% pay rise for the supporting staff. Let me pick up the point made by Alice Mack. Well, today, trade unions have spoken and they have talked about the different pay packages enjoyed by old staff and new staff members. You engage a consultant to carry out a review. I understand that you have got some findings in the first stage, so I want to know when you're going to get the final report. It would, of course, entail resources. There will be resource implications. I want to know about the position of the Secretary.
The HA, for the second phase of study, that would come out in September, October, the third quarter. As for the resources, needs of resources, we have already presented it to the administration. So in the study itself, we have included the old regime supporting staff. Well, why is it that there's such a delay? Because it has been a year ago that we wanted to do this study. Well, it was at the end of last year when we engaged the consultant, and we hope that some of the recommendations could be implemented. So we accelerated the first phase. However, for the second phase, with respect to the promotion for the third level, A and B could be combined together. Well, it does not exist in this the grade list now. So we need to provide them with a list of the grades. Well, for the old regime, if we change the new regime, then how would that impact on the old regime? We need a few months. So conservatively speaking, we hope to finish the second phase by September. Mrs. Zhang Lei-wen. Well, HA has, in the past period, they have given us fairly good service in the public hospitals. However, in the last few years, was the manpower shortage so severe. I have gone to the hospitals recently, and I could feel a deterioration of morale. So I think the management should study that. There are also cases of bullying in the HA itself. I have not received direct complaints. Perhaps I have missed some email. If cases like that are really serious, well, I would welcome that you come to us, the legislative member, for us to help you deal with them. Well, the Secretary mentioned just now that doctors now could bypass internship that would attract doctors to Hong Kong. Well, that cannot be done. Well, if there's no internship, they would go directly to the private hospital. So are we going to force them to go to public hospitals? Maybe you could answer this question. Now, there's also a problem of remuneration, 70,000 or 80,000 a month. Well, if they have children to go to schools and the high rents, how can you attract them here? If we are to look at the practice that we had before, we had doctors from the Commonwealth. For instance, the pale blue are non-locally trained, and the deep blue ones are the locally trained ones. However, can you see the dark blue didn't increase and the pale blue part disappeared. That is why we have such a shortage of manpower. So we could really be lenient for the medical areas that cropped out in such a situation. Nurses are also in short supply. Well, could you promise us that you would find enough doctors in a few years? Well, it is a matter of policy. Well, the secretary should really try to meet the demands or the requests of the public. Mrs. Yong Ho Yan. Mrs. Chan. We are speaking about the governance of the HA and the manpower problem. And Mr. Leung pointed out that many years ago, you have reduced the number of places for doctor training, and we have also the aging population. However, while figures have shown us the recent situation, very often, well, for 2017-18, for the radiation therapy, for the ophthalmology, you have lots of attrition percentage. And for nurses, they are also dissatisfied. For the administration and the HA, even if the situation is deteriorating and we are providing more and more resources to the HA, however, these problems have not been solved. So I'd like to invite a frontline nurse, Mr. Lau Hoi-man. Why is it that with all these increased resources, why is it that solutions have not been found? Why is it that there is such a high wastage rate for doctors and nurses? How can we improve the management or the governance? Mr. Lau? Well, Mrs. Chan has really raised me up. I am just a plain nurse. Now, why is it that there are increasing resources given to the HA, and yet frontline staff have not seen visible improvements? Maybe it's because of bullying, maybe it's because of a distribution of software and hardware. There is a cost analysis, being trumpeted. However, I think that this is a problem of management. The distribution of resources, it has not been effective. Well, these we can see that for the directors and the senior top management, they are being designated by the CE, and the decisions are made by the top management itself. HA is really spending wrongly the money, the taxpayers' money. Well, they have 70 million for agency nurses, and there has not been effective retention of personnel. It is not adding salary or promotion opportunities. Well, I think that what is effective is a 5-day week, and then you calculate from a 5-day week the staffing that you would need. Perhaps serious consideration can be given to that. We are now exceeding our allotted time by half an hour already. Well, I thank all of you for coming here to present your views. We have a 3-minute break, and this will allow us to replace nameplates and to allow the deputations and individuals to come in. we will restart again at 28 minutes past 7.